Canadians like to think that gun violence is an American issue, and certainly it's a much bigger issue there because of the gun control part of the debate. In both countries, however, it's most often been a conversation focused on law enforcement. There is now, in Ontario's capital city, another approach that's being considered. It's a public health view of gun violence, and it takes a very different path to confronting the problem. Joining us now for more, Chris Glover. He's Toronto District School Board trustee for Etobicoke Centre and a member of the Toronto Board of Health. Ju-Young Lee, Associate Professor of Sociology at the Munk School of Global Affairs Center for the Study of the U.S. Zia Brown, Founder and Program Director at Think Twice, an organization providing support to at-risk youth, and writer and political analyst Angela Wright. And we're very pleased to welcome all of you to TVO tonight for an important and timely conversation. And to set it up, let's play a clip. This is from a TED Talk by Dr. Gary Slutkin, who is the founder and CEO of a group called Cure Violence. That's an NGO focused on a health approach to violence prevention, and here he is explaining how this model works. Sheldon, go.
The maps of violence in most U.S. cities looked like this. There was clustering. This reminded me of clustering that we'd seen also in infectious epidemics, for example, cholera. And then we looked at the maps. And the maps showed this typical wave upon wave upon wave, because all epidemics are combinations of many epidemics. It also looked like infectious epidemics. And then we asked the question, well, what really predicts a case of violence? And it turns out that the greatest predictor of a case of violence is a preceding case of violence, which also sounds like if there's a case of flu, someone gave someone a case of flu, or a cold, or the greatest risk factor of tuberculosis is having been exposed to tuberculosis. And so we see that violence is, in a way, behaving like a contagious disease.
Violence as a contagious disease. Chris, I want to start with you because you recently put forward a motion of the Toronto Board of Health that would take a different look at something that we have considered and been worried about for a very long time. What's the idea?
So usually when we think about gun violence in the city, we look at it from guns and gangs perspective, and the response has always been solely a police response or a little bit of social work. But what the motion proposes is to take a public health approach, to do exactly what Dr. Slutkin is talking about, to look at it as a virus that's spreading from throughout neighborhoods as an epidemic. And so the question then is, how do you interrupt that spread?
Julian, why, in your view, would that be a preferable approach to take as opposed to the more traditional approach?
It's a preferable one because we often take for granted and assume that violence is inevitable, that people are going to get shot, people are going to commit crimes. But if we look across the globe, there are many different societies where shootings are not happening as frequently as they are in Canada. And those countries, such as Scandinavian countries, for example, provide an example of how we can create a structure that will help prevent young people from getting involved in gangs and guns and that kind of thing.
Let's add some numbers to the conversation here just so we can get a better handle on what we're in fact talking about. And again, Sheldon, I'll ask you to bring up these graphics. Here's gun violence and gang activity. 2016 is the year for which we have the most figures, an increase of 30% since 2013. And gang-related homicides continue to involve firearms at rates significantly higher, 76%, than non-gang-related homicides, which is only 20%. And let's do one more chart here. The Hospital for Sick Children and the Institute for Clinical Evaluative Sciences, which has the worst acronym ever, ISIS, published a study last year on children and youth injured by firearms in Ontario, and here's what they found. Every day, a child or youth is shot in Ontario. Every day. And 75% of those injuries are unintentional. Of the 355 firearm injuries per year, approximately 23 to 25 children or youth die from those injuries. That's about 7%. 25% of firearm injuries are assault-related. The risk of being a victim of firearm assault is 43% higher for refugees than for those youth born in Canada. Again, from Sick Kids and ISIS, those numbers. Based on what you know about this issue, does that tell the story as you understand it?
Well, first of all, I'm actually a little bit surprised at those stats. I didn't know that. I didn't know that there's a child that's shot every day. I think that some of those issues are different than the issues that we face in the streets with gang gang issues. So when it comes to children, gunplay, I think that's a little bit different. As for the gun violence in the communities, I feel that we need to focus on people with lived experience and people that are in prison who have experience in that street culture to be the ones who are, in fact, helping the young people to get out of that. So prevention and intervention.
Is that what you're about at Think Twice?
Yes, it is.
Tell us more about your mission. What are you all about?
Think Twice is an organization that provides supports and programming. They are non-traditional, culturally sensitive for young people who are in prison. We focus on federal institutions and also young people in high-risk communities.
Gotcha.
Or communities that have potential and opportunities. I don't like the word high risk. So with that being said, we provide supports and programming. We started after 2005. 2005 we called it the Summer of the Gun.
I remember
so
it. Yep.
that was the purpose for our program, was to try to combat the gun violence in the city. We started by having a program, a drop-in group every week for young people in the community. And they would come in and talk about how their week was. At risk of gang involvement, would talk about how their week was and the supports they needed to get through. And we also had a program for people that were in Sunnybrook, victims of gun violence. And then we had a correspondence program for people that were in jail.
Okay, let me get to Angela here for a second on whether or not those graphics that we showed with the information they're on jives with your understanding of the difficulty of the problem right now.
So what's interesting for me is that when we talk about gun violence in this country and in North America, we almost always are talking about gun-related, firearms-related homicides. But we need to extend our understanding of gun violence way broader. So there are really four kind of main types of gun violence. So there's homicide, assaults, like the use of firearms when committing crimes, and there's suicide. So in Canada, we don't talk about suicide, but the vast majority of gun-related deaths in Canada are actually suicides. So we need to talk about that as well. And then there are accidental shootings. So that's what the Hospital for Sick Kids, that's what they found, that the majority of shootings related to young people are actually accidental because children are picking up guns and they don't know what they are, and they're injuring themselves or injuring others. And the last is then police shootings. And so that's very different because on the one hand, as police force, they are kind of allowed under the law to use firearms, but at the end of the day, communities are still affected by police shooting. And so we need to talk about all of those four different types of gun violence if we really want to kind of tackle the problem, and then also if we really want to understand how gun violence is impacting all communities and all Canadians.
Okay, let's pick that apart a bit. Chris, let me follow up with you. If suicides are one of the most significant, or I think you said number one, issue with gun violence, why don't we talk about it more?
I think, I think we're in the case of suicide, we need to talk about gun regulation, because in a moment of depression, you shouldn't have a gun available to you, right? And so we've got to address that. And we can look at different countries around the world about the number of shootings. But for me, can I go back to the earlier question about, those statistics? I would have said 8 years ago, those statistics make a lot of sense to me, But I would say since I've become a school board trustee in 2010, I've attended 7 funerals of young men who've been killed. And I've talked to community members. There's one young woman who graduated from one of my high schools, and she lives in a townhouse complex. And one day she was walking out of her house with her mother, and she sees her friend at the next house, and she waves to him. And then they're walking out, and this car pulls up, 4 guys get out and start shooting at her friend. So she grabs her mom, they go back in the house, they lock the door, they barricade the door, and then they realize their friend is waiting for them in a car out front. So they start phoning their friend. They're in a panic, about their friend. Finally, she answers the phone. She's hiding under the steering wheel on the floor of her car. Her car has been shot up. And so, by this time, the police are coming, the guys have taken off. And so her sisters were in schools in my area. And so her sisters, she told me, we're too afraid to go to school. So we sent a social worker out, and that settled things down enough. But I started to realize as a trustee, I came across incidents like this more and more often. And I realized that there's a lot of street trauma that comes with every incident of gun violence. And that's why I brought forward the motion. That's why I did some research on this. And what the research shows is that from birth to adulthood, there are impacts, health impacts of exposure to community violence. And for most of us in the city, gun violence is something we read about in the newspaper, some statistics like that. But for people living in violent communities, it's a daily thing. There's the fear, there's the trauma, there's the depression, anxiety, PTSD. All these things are showing up in the research, and they're in people's lived experience. And that's the purpose of that motion.
So again then, if the traditional approach to the example that Chris just gave would be to send the police out en masse and start to make some arrests and tackle it that way. What's the new approach, the different approach that you think might pay dividends?
Well, some of the different approaches that people are rolling out in different cities with pretty good effect. So a colleague of mine, Andy Papachristos, who has done a lot of work that Dr. Slutkin draws from, has done some work looking at social networks of particularly at-risk youth in neighborhoods where there are a lot of shootings. And what they find in this body of work is that there's a small group of individuals who commit the most, or who are at the most risk of committing gun violence, and that there's a small group of people who are similarly most at risk of getting shot. And so the idea is, can we figure out who those people are, and can we intervene and direct and funnel resources towards them?
Intervene in what way?
By connecting them to social workers, connecting them to community activists, giving them supports if they're getting out of prison, and just basically, taking a different approach and not assuming that, the only way to stop gun violence is to arrest people and to sort of go into these communities and, increase the trauma that Chris was talking about when you have police coming in and knocking down doors.
If they're part of a gang, do they want to have anything to do with social workers?
A lot of times, so this is the surprising thing, a lot of my work has been done in South Central Los Angeles, which people call the gang capital of the world. And what you find is that if you talk to young people, a lot of them want to get out. Yeah. They want to find an alternative to that life. But for various reasons, they're sort of in it, for a long time. And they have friends who are in that life, and so they just need to be given an opportunity to get out.
At the risk of asking what sounds like an incredibly naive question here, how easy is it to get a gun in this capital city of ours?
It's very easy.
Really?
Yes. So
how do you do it?
I don't know exactly how you do it. I haven't actually tried to procure a gun illegally. Obviously, there are legal ways to get a gun, which is not as easy. But the thing about it, what we're finding out now is that there are significantly more domestic guns being used in homicide. So originally, the thought was always that most of these guns are being smuggled across the border. Yeah. But what's beginning to happen is that guns that are originally purchased legally are then finding their way onto the black market. So whether it's people buying guns legally and then selling them onto the black market, or whether these guns are then being stolen. But in some of the work that I've done, I was speaking to a mother, and her 14-year-old son told her that with $200, he could get a gun by the end of the school day. So that's very easy to get a gun, yes.
Did he tell her how?
He didn't exactly tell her how, but the understanding is that through kind of school networks, then yes, you would be able to get a gun. Because
he knew people who kill people.
Or who at least were able to find guns, yeah.
Huh. This sounds impossible to solve. I'm sorry if you don't mind my putting it that way, but if it's that easy, do you really think you can turn the corner on this?
Absolutely. So there are 3,000 shootings a year in Chicago. There are 400 in Toronto. There are 3 in Helsinki, Finland, right? There are 11 in the whole country of Japan. And the difference in these 3 jurisdictions is the public policies that they pursue. Like if we really want to address gun violence, we need to address the growing gap between rich and poor in the city, the growing neighborhoods of poverty, because poverty is the breeding ground for gun violence.
Does that sound right to you?
I do agree that poverty is a breeding ground for gun violence. I do believe that we do need to address poverty and privilege. Yes, I do agree with that.
How do we do that?
We need to address systemic issues. I mean, in everything that we're facing right now, it's starting from the systemic level. So we need to address systemic inequalities, systemic oppression, and then that's on a people level, and then on a personal level, we need to have programming that young people can relate to.
I don't want to get too far off the path here, but you know, it's at some point somebody is going to suggest that this is well, we've seen the numbers already in refugee communities and particularly in racialized communities. This is a bigger thing. At some point, somebody's going to say there are lots of poor white people in this city who don't want to be blamed for problems that they are themselves victims of as well. Is that fair to say?
Well, I mean, there's many issues when it comes to that. I mean, I don't really want to get too systemic, but there's intergenerational trauma. You know what I mean? So there's unresolved trauma and grief that is a big issue within the community. Yeah, so that's what I would say.
Okay.
There's different issues for different.
Ju-Young, please follow
Should
up.
I jump in on that
Please.
note too? So another way to reframe that kind of reaction to our discussion would be, you know, there was a report by CBC last week that showed that black men are significantly much more likely to be shot and killed in routine police arrests. So one response would be, so how can we change society so that black men, indigenous youth, are not being profiled all the time, right? Because that's a significant barrier to entry into the labor market, into building a life that can help people sustain a world and a family outside of criminality. So if we want to really address these larger issues, we have to address these systemic issues, as my colleague is pointing out.
Can I also give you an example? Sorry, Chris, but you ever watched the movie Megamind?
No.
Well, Megamind is about a blue character that was told how bad he was until he became the best at being bad. So if we continue to tell a people how bad they are, then they're going to be exactly what you're calling them. Number one. Number two, if there's issues that need to be addressed and we fling them into poverty and into anger, and they have no programming or no trauma supports to help them, then you know what's going to happen is that trauma is going to turn to retaliation and anger.
Right.
And, you know, and this is not just a racialized community issue. My son's friend was killed, and he's a white male. He was killed by a white male. They were two young guys, 18 years old, and they had a dispute. And they were standing at the corner of Yonge and Bloor. My son's friend started to walk away. The other kid pulled a gun out of his backpack and shot him 5 times in the back.
At Yonge and Bloor.
At Yonge and Bloor, yeah, a couple of years ago. You know, so it's not just and this is like it's an issue of people now, you know, young people and developing a culture where conflict is resolved with guns. You know, and how do we change that? How do we go into communities and say this isn't the way? There's an alternative way of dealing with disputes, and that's what, you know, part of the Cure Violence approach is. They hire interrupters who are people who've been in the streets, who've been in jail, and they have the credibility and the to go into those communities and say when there's an incidence of violence, how do you prevent retaliation? How do you prevent that from spiraling to the next incident of violence? And this is what, you know, Zia's program's about. Like, she works with inmates in prisons and makes them into mentors for young men, and then she buses young men in, and they do theater programs in prisons. You know, so it's about not just labeling people as bad or good, but recognizing that there are systemic issues that they're dealing with, that there's a culture that they're part of. And it's really hard to break out of, but so many people want to get out of that culture.
Let me just follow up. I hope my question wasn't misinterpreted, and if I didn't put it elegantly, let me try it again here, which is to say, and your example speaks to it, there are people in all communities who are the victims of gun violence. And to be sure, we're seeing that refugees and perhaps racialized people are disproportionately victims of this kind of thing. But everybody's a potential victim in this. Isn't that fair to say?
Of course. I mean, not just what Chris was saying, but also when we think of suicides, the vast majority of people who are killing themselves with the use of firearms are middle-aged white men, and oftentimes in rural areas. And so that's why we want to think it not just about homicides. But not only that, when you think about gun violence, we often talk about it as kind of being kind of left in particular communities, but that's not true. I mean, there was the shooting at the Eaton Center a few years ago. There were shootings on Yonge Street. There's shootings in the entertainment district. And the thing about bullets is that bullets don't discriminate. I mean, once a bullet is fired, it can ricochet off a car, it can ricochet off a building, and someone who's not the intended target can end up being injured or killed, which does happen.
Julia.
Can I jump in too? And another reason why everyone should care, and this is not just an issue that's a Black issue or an Indigenous issue, is that there's a broader economic impact related to all shootings, fatal, non-fatal. All of the medical services that go into saving a life that sometimes dies on the operating table, the payouts for somebody who has a lifetime of disability. These are things that affect all Canadians. It's not just one community funding the wounded and the dead. And so regardless of your partisan position, you should care about trying to cure gun violence, because there's figures that millions of dollars of productivity are lost over the life course when a person is killed, oftentimes in their 20s or early adulthood. So there's a lifetime of need and disability that an individual is, even if they survive, they're patched up and sent back into the community, and they live with injuries that are going to take them out of the labor market, so they can't become productive citizens again. So this is something that transcends politics and race.
We should probably as well put to bed the myth that if you take somebody's gun away, somebody who's determined to kill themselves, they'll just find another way to kill themselves. Yeah. That's not true, is it? No. Do you want to speak to that, Angela?
Right. So what they find is that when it comes to suicide, even the amount of time that it takes for someone to actually commit the act lessens the likelihood of them doing it. And so because guns are so easy and so fast, it becomes that much easier. But then what they found is that even having an extra 5 minutes reduces significantly the likelihood that someone will actually kill themselves. And that's why they found in Switzerland, what they ended up doing is that they essentially took guns away from soldiers and people who were in the army during the weekends, and what they noticed is that suicide rates went down significantly. And so it's just having a gun in the home increases the likelihood that someone in the home will be shot, whether it's intentional or unintentional.
What are the next steps here?
So there's a number of things. So we have a seminar coming up on April 30th at Humber College, and people are invited. If a public health approach to gun violence is an issue that you're interested in, come to that seminar. There's information about it on my website, chrisglover.ca.
This is at the Lakeshore
campus of Humber College, yeah. 10 o'clock on April 30th, Monday, April 30th. Let's see, and then the other thing that, I want to put a plug in here, because Zia does really courageous work in prisons with young people from communities that are at risk. And she didn't get her Trillium grant renewed. So the program is at risk, and we need to find some funding for Zia's program so that she can continue the work that she's doing. Because going in and getting, inmates doing theater work with young people, telling their stories and creating their narratives, it's such a wonderful, wonderful way to turn this around. And it is absolutely about a public health approach.
Well, let me do it. We got a minute left here. Tell us, if you got your grant renewed, what would you do?
Well, we didn't get it renewed. We applied for a grant. We didn't get it. We haven't had a grant with Trillium, but so we have a program called the Kings to Kings program, and that's where young people that are incarcerated will share their story with youth that are at risk in the neighborhood. So we bring the at-risk youth into the prison, and the young men inside will talk about the mistakes they made, the hardships that they faced as an individual who's incarcerated, what an older me would say to a younger me.
You think prisoners have special resonance on this issue?
With this issue, I think they're the answer. Yeah. When it comes to the personal level, not the systemic, but on a personal level, when it comes to youth at risk or youth who are involved, I believe that they are the answer.
Okay. I want to thank you all for coming in for this discussion. I told you it would go quickly, didn't I? That's our time. Thanks to Ju-Young Lee from the Monk School at U of T and Zia Brown. Think Twice is the name of her program. And on the other side of the table, Chris Glover, the TDSB trustee from Etobicoke Center, and Angela Wright, writer and political analyst. Thanks, everybody.
Thank you very much, Steve.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.